Tonight, learn about the treatment options for endometriosis, fibroids, and infertility. Penn State Health Experts will also provide insight to help women overcome barriers to starting a family. Plus, have your questions answered in a live web chat with a women's health specialist on Family Matters, Women's Health, an ABC 27 special presentation, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Tonight, Penn State Health Experts are here to talk about women's health, and that includes endometriosis, fibroids, and infertility. March is Endometriosis Awareness Month, a time to raise awareness of this common but often underreported chronic disease. Endometriosis affects 10% of women of reproductive age. Doctors will answer some important questions like, what are the signs and symptoms of endometriosis? What are uterine fibroids, and what are the latest treatment options for infertility? And if you have questions at home, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hi, Deborah, and thank you. Those are such important questions, and we have a perfect expert to give you those answers live on our web chat. We have Dr. Arpit Dave, gynecologic surgeon with Penn State Health, and he'll be here until 8 o'clock answering questions live on the web chat. So get your questions in. You can submit them by going to abc27.com/womens. That's WOMENS. And we'll be back in a little bit later in the show to share some of the questions that viewers have sent in. In the meantime, it's back to you, Deborah.
And thank you, Donna. Endometriosis is a condition that affects millions of women, yet it often goes undiagnosed or misunderstood. It can cause severe pain, fertility challenges, and a major impact on daily life. And joining us right now to talk about this very important topic, Dr. Kristin Riley, Chief of Minimally Invasive Gynecologic Surgery at Penn State Health, and Dana Ray, an endometriosis patient who is passionate about women's health education. And Dana, why don't you first of all talk to us about the struggles that you have gone through, and what was that like?
Of course, I knew that I was having problems with my periods around 2015, so 10 years ago. But looking back, I can see that I was having challenges way before then. Endometriosis looks different for every single person. For me, that looked like a lot of fatigue and exhaustion. I would have trouble getting out of bed due to blood loss and anemia. I had clotting, severe pain, and my life simply just got smaller and smaller. I made a lot of adjustments to accommodate for myself. I would cancel trips. If I thought that it was going to impact my period, I would cancel time with friends. I got health interventions that I needed that could have been really dangerous. My life just grew smaller and smaller, often without me realizing it, slowly over the years.
And Dr. Riley, oftentimes endometriosis goes misdiagnosed. Why is that?
Well, it can take a long time for patients to get the diagnosis of endometriosis, on average 7 to 10 years. And the reason for that is there are a lot of different symptoms that patients present with. Classically, we think about patients who have pain before, during, and after periods, but people can have other symptoms too, pain with bowel movements, back pain, pain with intercourse. So that's one reason that it's hard to diagnose. The other reason is that there is no non-invasive test. There isn't an easy blood test or an imaging study.
Wow.
We have to use surgery to diagnose endometriosis.
Oh my goodness. So Dana, talk to us about your journey, because you saw multiple doctors before you got some answers.
I did. I spoke to every doctor I saw over many, many years about what I was experiencing. And I saw some smart, kind, compassionate people who just didn't know how to help me. And I saw some people who said some really ridiculous things, which is not uncommon for people who have experienced endometriosis to just hear some wild things over the years. And a lot of that really changed for me when I found Dr. Riley and her team, and that was because of my younger sister. She's 8 years younger than me. She was having increased difficulty and pain and said, I don't want to suffer anymore. She decided to go ahead with the diagnostic surgery, and it came back positive, which kind of blew me away. And I was like, you know what? I should do this too. I met with Dr. Riley, and from the very first appointment, I felt heard and affirmed. I didn't have to over-explain anything. I could say, I'm having this symptom, I'm having this experience. And Dr. Riley was ready to meet me where I was and find ways to manage those experiences with surgery, without surgery, making a plan together. It was truly collaborative medicine, and I hadn't experienced anything like that to that point.
Well, thank goodness you found Dr. Riley. And Dr. Riley, so what are some of the symptoms for our viewers who are watching that you should say, yeah, you really need to get this checked out?
Yeah, so endometriosis pain is worse than, some people are told that you're just having bad periods. It's a lot worse than that. It's people who really can't do the things that they want to do. So pain with periods, sure, but the type of pain that prevents you from going to work or school or going to events that you want to be at, and really affects your life, like it did for Dana.
And Dana, so when you did get the diagnosis, I mean, how did that make you feel?
I woke up from surgery and I was triumphant. I was so excited to find out that I had endometriosis, which is, it's not great to get a diagnosis, but I was so thrilled. Having a name for all the experiences that I had gone through really helped clarify what had been happening, and having a team that I knew I could trust going forward, because this disease isn't over, I still have it, and I will always have it, and so having a team that I can trust to be with me through the different stages is really hopeful and encouraging.
And Dana, you mentioned surgery. Dr. Riley, why don't you talk to us about the different treatment options, because not every woman is the same.
That's right. So there are a lot of different options for management of the pain that goes along with endometriosis. We think about medicine, surgery, and complementary therapies. Medicine includes things like hormonal treatments, pain medications, and surgery is used as a diagnostic tool like we talked about, but also to remove endometriosis, which can help people with their pain. Some patients need a hysterectomy, but not everybody. And we don't consider any of these things a cure, but more management strategies to help deal with the pain. And at Penn State Health, we have a multidisciplinary chronic pelvic pain and endometriosis team that's comprised of a number of different subspecialists that can help manage all the different things that go along with endometriosis.
Now, Dana, when we were talking earlier, you said you recently had this surgery last fall, but what changes have taken place in your life?
The biggest change has been mental for me. The emotional impact of a chronic illness can be really profound, and having a diagnosis helped me feel like I understood myself. It gave me compassion for my younger self, who was honestly really embarrassed by what I experienced. By having periods I felt like I couldn't push through, with experiences that I thought I should be able to manage but just couldn't. So it's been very, very freeing.
Dr. Riley, for our viewers who are watching, what advice would you give them if they are, feeling this, if they're struggling and saying, maybe I should get this checked out?
Yeah. Don't give up if you feel like you haven't been listened to. Get another opinion, and specifically look for a minimally invasive GYN surgeon who works with a multidisciplinary team that can help manage all the various symptoms that you're having.
And Dana, for you struggle for a number of years. What message do you have for those who may be struggling in silence?
To echo Dr. Riley, it's about not giving up. There is a level of relentlessness you have to navigate healthcare and get what you need. And that can be really daunting and discouraging, but to keep pursuing and knowing that what you are experiencing is valid. If it is hard for you, it's hard. If it is difficult for you, it's difficult. It doesn't have to look like anybody else. I had friends when I was younger who had really severe symptoms of endometriosis. They had the diagnosis, and I thought, well, I can't have this disease because they have it so much worse than I did. And that just wasn't the case. That wasn't true. So keep going, keep pushing for an answer, and know that you are worth taking care of. You are worth getting answers for. And your body's not lying to you. There's something going on.
Yeah, if it's that severe, there's something definitely going on. Dr. Riley, why don't you talk to us about the future treatments for endometriosis?
Sure. So I think one of the biggest things is, you talked about March is endometriosis awareness, and really raising awareness about this condition, educating all of our colleagues about it is really important. One of the big areas of research is diagnostic tools, trying to find a non-invasive test and non-surgical methods to manage endometriosis.
Well, Dana, thank you so much for being here and sharing your journey with us. Dr. Riley, we will talk to you a little bit later in the show. And if you would like more information or if you would like to make an appointment with Penn State Health Women's Health, call 717-531-3503 or visit online at pennstatehealth.org. Now, Penn State Health is presenting a free webinar, Endometriosis, Your Voice Matters, on Tuesday, March 25th from 6 to 7 in the evening. Experts will discuss the condition, diagnosis, procedures, treatment, and also pain management options and available clinical trials. Scan the QR code to register. Now let's check in with Donna Kirker-Morgan. Donna, what are some of the questions being asked?
We have a wide range of questions coming in live to our web chat. We have Dr. Arpit Dave, minimally invasive gynecological surgeon at Penn State Health, busy typing away, answering those questions. Here's our first viewer question. I have irregular periods and was told I might have PCOS. What is PCOS and how is it treated, doctor?
That's a wonderful question. PCOS, or polycystic ovary syndrome, is a hormone-related condition that affects ovulation, metabolism, and even long-term health risks like uterine cancers and diabetes. It's actually the most common endocrine disorder in women. It's called a syndrome because it's really a collection of symptoms, and we're actually still really exploring the underlying cause of it. The most common signs include irregular periods, excess hair growth in places that are maybe more typical for men, acne, and sometimes multiple follicles on the ovary seen on ultrasound. The treatment really depends on your goals. If you're trying to build a family, medications can help regulate ovulation. But if pregnancy isn't a concern, sometimes non-hormonal medications, birth control pills, IUDs, can help regulate those periods and reduce cancer risk. Since PCOS also increases risks of diseases like diabetes and high cholesterol, managing lifestyle factors also matters a lot. These can be done with medications, physical activities. Some of the world's foremost experts in PCOS are right here at Penn State Health. Come see us, we'd be happy to help.
Thank you. And this viewer is asking, and this is very, very personal and a sad one, but she says, I had a miscarriage in the past and now I'm struggling to conceive again. Could there be an underlying issue, and what should I ask my doctor about that?
First of all, to that viewer, I'm really sorry to hear that. In fact, I'll just start by saying your family and mine both share that very common human experience. I will say that the vast majority of women who experience miscarriage will go on to will successfully build the wonderful families that they dream of. That doesn't make it any less difficult to go through.
Yeah.
There are lots of potential underlying causes, and ultimately a conversation with your OBGYN is the best way to get that sorted through. My wife and I went to the wonderful OBGYNs at Penn State Health to help us through that process as well, and we'd be happy to help you as well.
Lovely. Well, if you have any more questions for the doctor, go to abc27.com/women's and submit them. He will be here until 8 o'clock answering questions live on the web chat. But in the meantime, stay with us. We'll be right back.
When a child is diagnosed with pediatric cancer, what's important in life is your family and your children. I just love being able to take care of these kids and bringing them hope and helping to make them better. Neuroblastoma is a pediatric cancer that happens in children on average about 5 years of age and younger. So it's a very aggressive cancer.
We first learned of Ford's diagnosis August of 2019. Never could have imagined our rambunctious 2.5-year-old facing something like that. With Ford having 3 relapses, we have to think outside of the box.
DFMO, its generic name, iwelfin being the brand name, is a drug that targets the cancer stem cells. So instead of about 30 to 40% of children relapsing, now we're seeing only 15%.
If you're going to have to fight this, you want the leading experts in the world to be helping you.
We're learning every single day how to do better.
1, 2, 3, 4.
We won't be done working until every child is cured.
You're watching Family Matters, Women's Health on ABC 27, sponsored by Penn State Health.
Welcome back. Fibroids are a common condition that can impact a woman's health, causing pain, heavy periods, and even infertility. So what are the best treatment options, and when is it time to seek help to start a family? And joining us right now is Dr. Samantha Butts, Chief of the Division of Fertility and Reproductive Endocrinology. So, doctor, what are fibroids, and really how common are they in women?
So I should start by saying that the uterus itself is made up of smooth muscle cells and connective tissue. All the fibroids are growths derived from those cells in the uterus, and they are incredibly common. The likelihood that any woman will develop fibroids by the age of 50 is 70 to 80%.
That's a lot.
That is a lot. And I should also mention that they're common. They can look differently in women depending on size and location. Fibroids also represent an important health disparity in gynecology, such that women of color, African American women, are typically affected more commonly and have more severe symptoms and complications with fibroids.
So you talk about symptoms. What are the symptoms?
The symptoms really depend on, again, the size and the location of the fibroids. Some patients can have fibroids and never experience symptoms, and we diagnose them when we are doing ultrasounds for other reasons. Some patients are not so fortunate. Large fibroids can cause pelvic pain, pressure. Depending on whether or not they're affecting other organs in the pelvis, they can cause urinary symptoms, gastrointestinal symptoms. Amongst the most devastating symptoms associated with fibroids are heavy, prolonged periods that can be devastating enough to cause severe anemia that can require blood transfusions and severe and need for urgent medical care.
Oh my goodness.
Yes.
Talk about treatment options.
So treatment options fall into a number of categories, and it really does depend on the symptoms you have, the severity, where you are in your life in terms of family building, childbearing goals, makes an impact. We have highly effective medical treatments, surgical treatments that can remove fibroids, medical treatments that can control some of those bleeding symptoms I talked about, shrink fibroids. All of these are treatments and not cure. The cure for fibroids is a hysterectomy, but that is not an appropriate treatment for somebody who wants to build a family. So we really think it's important to have conversations with experts who manage fibroids regularly, do the diagnostic treatments, and then come up with a plan for which option works best for you, your goals, and managing your symptoms.
So you mentioned starting a family. So how do fibroids affect pregnancy?
We think they can affect pregnancy in a number of ways, from the earliest stages of pregnancy to later in pregnancy. Again, depending on the size and the location of fibroids, they can impact the likelihood of miscarriage, increasing that risk in some women. There's reason to believe that fibroids can also impact pregnancy complications in the second and third trimester, preterm delivery, and other complications, including pain, as they affect women outside of pregnancy.
So if they're having problems getting pregnant, when should they reach out to someone about this?
So my philosophy is that it's never too soon to have a conversation about your pregnancy goals and aspirations, even before starting to try. We think pre-pregnancy consults are incredibly important, incredibly valuable to help identify conditions that can impact the likelihood of pregnancy and complications in pregnancy, like endometriosis, as we've been discussing in prior segments, fibroids, and things that can be understood and managed and can affect the risk of pregnancy complications as well. In general, we typically tell patients that if they have been trying for 6 to 12 months, depending on their age and medical history and background, that would be a good time to have a conversation with a fertility expert.
So viewers who are watching who say, okay, maybe I should make an appointment, we should make an appointment. What can they expect when they come to your office?
So what they can expect first and foremost is that they are going to be listened to and heard. We put a lot of emphasis on collecting a comprehensive medical history of the female patient, if she's partnered, of her partner as well, and taking that information to then guide the next steps. Diagnostic evaluations, whether those are labs, imaging studies, if there is a male patient, evaluating parameters that tell us about sperm production, and then putting all of that information together to come up with a plan and individualized solutions for that person's case.
And what are some treatment options?
They really depend on what those assessments show us, depending on what we find when we're doing these assessments. If we were to diagnose things like endometriosis, as has been pointed out before, there are medical treatments, surgical treatments, fibroids as well. There are targeted fertility treatments like intrauterine insemination, in vitro fertilization, medications that target problems such as irregular ovulation. I think PCOS has been discussed by some of the patients calling in. All of these options are available in practices like ours at Penn State Health. We offer full scope treatments for management, and treatment of a whole variety of barriers to fertility.
And infertility is such a personal topic. What message do you have for our viewers who may be struggling?
The message I would send is that it is highly personal, but much more common, I think, than people realize. And I say that in the hopes that people will feel that this is far less stigmatized and isolating, and that there is a lot of expertise available to help people understand and manage their infertility. There's expertise in terms of helping people cope with the human element, the feelings of being overwhelmed by this, so that we can treat your condition, but also treat you holistically and support you through this process.
And that is so very important.
Thank
Dr. Butts, thank you very much. Stay with us because we will be talking with you more in our next segment. In the meantime, if you would like more information or if you would like to make an appointment with Penn State Health Women's Health, call 717-531-3503 or visit online at pennstatehealth.org. Now let's check in with Donna and get some answers to more of our web chat questions. Donna.
Thank you, Deborah. Yes, we're back. With us is Dr. Arpit Dave, minimally invasive gynecologic surgeon at Penn State Health. And we have another viewer question. This one is, can minimally invasive techniques be used for pelvic organ prolapse or urinary incontinence?
Absolutely. Pelvic organ prolapse and urinary incontinence are some of the most common issues that affect women of all ages, actually. You can absolutely treat these with minimally invasive techniques, including surgical and non-surgical techniques. Basically, our division of urogynecology within our Department of Obstetrics and Gynecology is filled with experts who can help you resolve these issues. Pelvic organ prolapse and urinary incontinence are issues that are not to be suffered, and we are happy to help.
Now, this viewer asks, what are the surgical options for heavy periods or abnormal bleeding?
Surgical options for heavy periods and abnormal bleeding really depend a lot on the underlying cause. We define abnormal bleeding as really bleeding that's irregular or unsatisfactory to our patients, and really in terms of how much blood patients have, the length of bleeding episodes, or really how often they're having bleeding. So if you're unsatisfied with your periods, please talk to an OBGYN. There are really more options than ever before. Surgical options can include things like placement of an intrauterine device, procedures to cauterize the lining of the uterus called an endometrial ablation, as well as removal of masses like uterine fibroids, like Dr. Butts just talked about, if they're the cause, and even some options that aren't performed by gynecologists, something called a uterine artery embolization. For women who don't get satisfactory results, other methods, or maybe can't use those other methods, surgery to remove the uterus and the cervix, called a hysterectomy, is also an option that's very successful.
Well, that is great. We really appreciate you answering these questions. You will be live on the web chat until 8 o'clock tonight. So if you want to still submit a question, go to abc27.com/women's. And in the meantime, we're going to go back to Deborah.
And thank you, Donna. Back with us, Dr. Kristin Riley and Dr. Samantha Butts. Dr. Riley, why is it so important for women to really advocate for themselves, to push and say, hey, there is something wrong?
I think we talked about sort of the variability in people's symptoms, and some people have sort of classic symptoms, and other people have slightly different pain symptoms or pain symptoms that affect their bladder, their bowel, and so really asking for help is important.
And Dr. Butts, women really are going to be looking to doctors, and as we heard with Dana, she saw numerous doctors. How can they say, hey, I know this is the right doctor, this is the person?
There's so much information available to us to research doctors. You know, my patients research me before they come in. I think having that information, reaching out to sources that you trust and are reliable to you. But I think really sort of how you feel coming away from that conversation. Is this a doctor I can trust? Do they seem to have integrity? Their experience, their credentials, right? Dr. Riley is a board certified, subspecialist, as am I. That experience and those credentials really matter in terms of what patients can expect in terms of the quality of care they receive.
And Dr. Riley, I mean, you know from Dana, she felt, I think, really not being heard. People weren't necessarily believing her. What advice do you have for people to really say, hey, this is a concern?
I think really highlighting the effect, the impact that your symptoms have on your life, and how really you're not living the life that you want to can make an impact when you're talking to your physician.
And certainly it's something where if you aren't feeling right, then you should really say, this is having a big impact on my life and I need to talk to someone.
That's right.
And I would say, Dr. Butts, there's so much information out there. I know that when there's something going on with me, I'll just Google it. I'm like, wait, could it be this? Could it be that? How does someone who's doing that and then also listening to their doctor, how do they weigh that out and say, you know what, they really know what they're talking about?
There are lots of online resources, as we've said. Some of them are sort of more vetted and validated than others. I tell patients to look at sort of the professional societies like the American College of OBGYN and other reliable sources like that. One of the themes of our questions and answers today has been communication and trust. And I think if a patient feels like they're not getting the answers they want, to address that with the doctor so that we can do as good a job as possible of answering your questions and gaining your trust.
Certainly, but if there's a concern, definitely seek help.
Yes.
Ladies, thank you so much for being with us this evening. And we also send a special thanks to Dana for sharing her journey and you, our viewers, for sending in your questions. If you would like more information or if you would like to make an appointment with Penn State Health Women's Health, call 717-531-3503 or visit online at pennstatehealth.org. And once again, Penn State Health is presenting a free webinar, Endometriosis, Your Voice Matters, on Tuesday, March 25th from 6 to 7 in the evening. Learn about the multidisciplinary approach to endometriosis and chronic pelvic pain. Experts will discuss the condition, diagnosis procedures, treatment and pain management options, and available clinical trials. You can scan the QR code to register. We want to thank you for watching tonight, and we wish you good health.